Language barriers are an issue that come up frequently in clinic. And as I think about it, there are really two different scenarios. In the first scenario, we have patients for whom English is their second language or who don't speak English at all. And of course, in that situation, it is important to have a medical interpreter. These patients often bring relatives, sometimes children or even grandchildren, with them to the visit to help interpret. But of course, that's really not enough. It's important to have a trained medical interpreter to make sure that all of the important information that you're trying to convey gets conveyed appropriately. But there's a second scenario that's a little more subtle, and that is sometimes there are patients for whom English is their first language, but the way we communicate and the way they receive information is a little different. And this happens a lot. So, what I try to do is make sure that I can communicate a full breadth of information, but in a way that is easy to digest and understandable in language that most people would understand, not just the language that we understand in the medical field. And what I like to do, if I'm not sure that my message has been fully received, is I ask the patient to repeat back to me what they heard. And that way, I have the opportunity to correct any misunderstanding or misinformation right on the spot, and I don't have to get a message a couple of weeks later. So, those are my tips for how to handle language barriers in the office.